Richard, good morning. Appreciate your time.
Well, good morning, Richard. Good to see you.
Yeah, great name. Thanks.
Yes.
Appreciate that very much. So as we move toward a new legislative session, I think that the thing that we probably will hear most in the coming year is income tax reform, reduction, removal, that debate. But running a close second, I think Medicaid expansion is right there again. It's something that has been debated. It is going to continue to be debated. It felt to me, and you tell me if I'm wrong here, like this past year, there was more momentum than ever there has been about this conversation of expanding Medicaid in Mississippi.
Yeah, absolutely there was, and and I'll say I'm a big fan of the top two of those legislative agenda items, both the income tax cuts and Medicaid expansion. And really for Medicaid expansion, it's simply expanding an insurance program to able-bodied working adults that are just making too little to be able to purchase insurance on the regular market. And they kind of fall into that gap where not all of them are eligible to buy policies with subsidies on the health insurance exchange, the federal marketplace exchange, and their employers aren't able to, for whatever reason, provide employer-sponsored coverage like many of us have. And so it just allows them an opportunity to have a payment source so they don't go into medical bankruptcy, and so that they can also access health care in the most appropriate setting and get more preventive care. So it's it's not a controversial program in the sense that it's just trying to help people provide a payment source for health care coverage.
There certainly has been opposition to this. And I feel like if you're going to advocate for something, you've got to understand the opposite side, understand why the opposition exists. So let's start there. The opposing viewpoint of no, we do not want to expand Medicaid in Mississippi. What's the basis of that argument?
Well, I'll tell you this. So early on in my career, I worked at the Division of Medicaid for almost a decade, and much of that time was spent working in the agency under Governor Barber's administration. And I was there when the Affordable Care Act came out, when it narrowly passed, and all the stories about that are very interesting, and how it finally came to be in its form, even though it was a kind of a flawed form when it finally left Washington. But but I was there at the agency when we were looking at trying to implement that thing, and then the Supreme Court made it optional instead of mandatory. But our concern, speaking from someone that worked under Governor Barber and at the agency, was simply how are we going to pay for this thing? Mm-hmm. That was the scary part of it, or the scariest part of it. It was hard to say that we didn't have sick people. It was hard to say that we didn't have low-income people that could have benefited from it. And it was hard to say that we didn't have health care providers, primarily hospitals, that weren't getting compensated for services they were providing anyway. And so, so it was simply a matter, really, primarily, of how are we going to pay that state share cost when that entire federal subsidy, which at the time was 100%, and then it tailored on down to 90%, eventually federal match funds. How are we going to come up with our 10%? Because we struggle to fund the program we had now. And if you remember back in 2010, 2011, 2012, when all this stuff was brand new and states were looking at it, for us, we were just a few years removed from the devastation of Hurricane Katrina, mm-hmm. and the impact that had on our budget, particularly on our coastal counties and the economy, in the southern part of the state. We were coming out of a BP oil spill. We were coming out of an economic recession. So the financial concerns were legitimate and very real. Where we find ourselves today, thanks to a lot of good work by a lot of good elected officials, is that our state economy is in the best shape it's ever been in. And we hear that repeatedly from all of our leadership. And that's a testament to some good, sound, conservative fiscal management of the state. But we've certainly got some ability and some means that we did not have 15 years ago.
So in terms of paying for this now, I mean, I do think that continues to be at the heart of the issue, whether we're talking about from the governor's office or from others who oppose it. But from those who support it as well, the relevant question is, okay, how does it get paid for? There is federal subsidy, but there's no guarantee that that's going to stay in place. And if that gets rolled back, then is Mississippi as a state left holding the bill, and can we afford it?
Yeah, so the way the legislature handled that issue last year was, ultimately it made its way through the House and made its way through the Senate. They came together and agreed upon a conference report at the end of the day, and there were provisions in there to where if the federal match went away or if it dropped below 90% federal matching funds, then we would pull the plug on the program. And I think that's certainly a valid concern, is to look at what happens when the federal government changes the rules of the game. If they're going to change the rules of the game on the payment side, then we do have to evaluate it, and we can't necessarily be held to the commitment we made if the rules change in the middle of the game. And so I think it makes sense to have some things in place where we look at what we're going to do if the federal match goes away. The way the funding was derived for this program that was in the conference report was to put an additional tax on the Medicaid managed care companies and probably, I think, other health insurance plans, but primarily the Medicaid managed care companies, I think, was the source. And and that would generate the additional revenue, and so it would minimize any impact on state taxpayers, and actually, I think, take it off of the state taxpayers to do that in the way it was contemplated in the conference report.
So, as the proposal exists right now, will this cost the state of Mississippi anything?
My understanding is that it would not. In looking at the conference report from last year, the tax was going to be funded by managed care companies.
Okay, so 100% funded there. And then you keep the safeguards in place if that changes.
That's right. That's right. So, so if the feds changed the rules, if the federal match rate, went below that 90%, then the state could reevaluate it. I think actually it automatically ended, or, would start to unwind, is the way the conference report read. But yeah, that's how it would roll out. And I think, the House's original position was for it to be a 4-year pilot program. And there were provisions in there not only to make it financially sound, but to actually do some things that right now we're not doing, which is stronger accountability provisions, and to measure and report out the quality of the program. Is it being successful in what it was designed to do? And and see how that goes for 4 years. Because the way the funding would work too is that not only would you get an enhanced federal rate for the new program, but you would get an enhanced federal rate for your current Medicaid program. And so that enhanced rate on the current Medicaid program would actually more than pay for, in the first couple of years, the new program. So there's some things in place that that certainly help you with launching a new program, but it also gives you incentives for some additional federal matching rate to come in for your current program that you run now. So that new money combined with more new money for the current program that we're running would alleviate a lot of cost to the program in the first couple of years.
Visiting with Richard Roberson. He is president and CEO of the Mississippi Hospital Association. We're talking kind of the healthcare community as a whole, some of the things that MHA is looking at as we move toward this next legislative session as well. Is Medicaid expansion more beneficial for the patients who need it or the hospitals who are struggling from a funding standpoint?
Well, it's a little bit of both. For patients, they're not getting a check. They're not getting a tangible free product, so to speak. They're getting their health care paid for, and so they're able to go to physicians. They're able to go, have preventive medicine done if they need, mammograms and other things that keep them healthier for longer. They're able to get that done. If they end up in the emergency room, they're able to have a source of payment. From a hospital standpoint, under federal requirements, hospitals are required to treat and diagnose and or stabilize or transfer a patient regardless of that patient's ability to pay. And so from a hospital standpoint, if you've got a lot of people coming in that don't have a method of payment, then they're just eating that cost. And eventually all of us who do pay for those services are going to pay more for those services to cover up the costs that folks who aren't able to pay are incurring. So it would certainly help hospitals, but it would also really help patients because they would have a payment source and they would avoid seeking care in a more costly setting.
More questions for Richard Roberson coming up on the other side of this break. He's president and CEO at the Mississippi Hospital Association. We're glad to be with you on this Monday morning, Thanksgiving week, 25th of November. Richard Cross and Lance with you. This is the Gallo Radio Show on SuperTalk Mississippi. More coming up after this. Thanks for being with us on the Gallo Radio Show on SuperTalk Mississippi. Richard Roberson is my guest, president and CEO of the Mississippi Hospital Association. We are moving closer toward the 2025 legislative session. We're talking about Medicaid expansion and how that is going to look in the legislature this year. Richard, what's the prognosis? I mean, what do you anticipate it looking like in the session? Does it get to the floor for a vote, or both sides, in your mind, in agreement?
Well, look, if I've been around the legislature for about 25 years, and predicting what's going to happen at the Capitol during the session is would be kind of a joke for me. Sometimes it goes the way you think it will, and other times things take a dramatic turn. I do think that a good starting place for the discussion is going to be the conference report that they left off with. And I say that because it aligns very closely with something President Trump did towards the beginning part of 2020. In January of 2020, President Trump issued kind of a roadmap for a very conservative approach to expanding Medicaid, and it covered low-income individuals in the same bracket as Medicaid expansion, and it put some accountability pieces in place. It put some checks and balances on runaway spending in the program, and made you kind of put a cap on spending per person or in the aggregate for the program. So there's some things that are very well tailored, I think, to represent some Mississippi core values, things that as Mississippians we support, which is one, folks working. So work requirements would be something that we believe a Trump administration would support, because they've done it before. That healthy adult opportunity waiver also allows a state to cover individuals who may be staying at home to take care of a small child or even another loved one who may need care, but you don't let that adult go without insurance or health care coverage themselves, who's staying there as the primary caregiver. And then it also allows for things that give coverage to full-time students, kids that may be in college or graduate school or medical school or law school, or folks that are going back to school to receive additional skills and job training and workforce training programs. So if they're enrolled in those, we could tailor this program to provide insurance benefits to them while they're kind of getting their legs under them. So I think we've got some opportunities to tailor this thing in a very conservative way that reflects some of the core values of who we are, and do this in a way that draws down that additional federal money that we're paying for now. It's just going to other states. And so I'm hopeful that they can reach an agreement that will be amenable to both the House, the Senate, and the governor, and that we can put this issue behind us, and let's see what the good things are that it does. And and look at, if it has to be a pilot program for 4 years, we measure it and see what's going on. The Trump waiver allows for that too, and the accountability parts of it. So we'd have that covered also.
I guess to me the part that doesn't make sense is, okay, if we're paying for this already, like it's coming out of our tax dollars already, why not take advantage of it? And that just seems to kind of make sense. I will ask you this. I mean, the governor has been adamantly against Medicaid expansion for a long time. He categorizes it as Obamacare Medicaid expansion. Is there any reason for you to believe that if this were to get passed in the legislature, that Tate Reeves would do anything other than veto the bill?
Well, so I was watching a press conference the governor did a couple of weeks ago on economic development, announcing so many of these great economic development projects all over the state. And there's a question that came up kind of, I think, out of the blue, or folks started going down a healthcare track kind of out of the blue. And the governor was asked about Medicaid expansion, and he made a comment that he had been in conversations with folks in Trump world about what something like this could look like, and he said that he was open to having the conversation. So, while certainly there was no commitment, and he reminded everyone of where he's been on this issue, which I respect. There was at least an opening or an appetite to listening and talking and thinking through it, which I think is important and very important to do.
Visiting with Richard Roberson, President and CEO at the Mississippi Hospital Association. Let's switch gears a little bit. One of the big topics in the healthcare world in Mississippi has been about rural healthcare and the difficulties that exist with some of the rural hospitals and providers in Mississippi. Is there any reason to believe that situation is getting any better?
It is getting better. It's still pretty tenuous and precarious in many parts of the state.
And if you just had to bullet out the issues, okay, these are the three biggest things that rural healthcare is facing that is a problem. What would those be?
Well, one of the biggest issues is simply revenue, and it's simply a fact of having a payer source for the patients that they treat in their communities, because in our rural areas, a large percent, or even larger than in our urban areas, a large percent of those individuals are high Medicaid or high uninsured or high Medicare. And typically those payers are not as good as a commercial payer rate. I was looking just probably about a year or so ago at one of our hospitals in a rural part of the state that was financially in some trouble. And the payer mix for them was about 8% commercial payments, meaning about 8% of all of the money that they got was coming from a commercial insurance company. And that's really, really, really hard to make ends meet with that, because the other sources are paying you either nothing or paying you right around your cost. And so it's just hard to reinvest in facilities when things go wrong, or to retain and recruit additional physicians and nurses and other folks it takes to provide health care. So revenue is a big issue. Population size is a big issue. As populations move and shift away from rural areas into more urban areas, and you look at the growth in Jackson Metro, you look at the growth on the coast, you look at the growth in South Haven, and even in small towns that are no longer so small, like Oxford and Tupelo and Hattiesburg and Starkville, you've got to have enough people there to sustain a wide variety of healthcare services. So what rural hospitals have done over the last several years is they've tailored certain services to what their community will avail themselves of and what's provided. So you don't see perhaps the wider array of services that maybe 40 years ago you might have seen at a rural hospital, where they all have a general surgeon or delivering babies, for example. So you've seen some of that go away. And that's just a result of some of the changes. So they're not trying to be everything that they once were, but they're still trying to provide viable services to their communities.
So I suppose in a perfect world, every rural community has a heart surgeon and has a general surgeon and has all of the options that are available to its local residents. Is the solution, or one of the solutions, simply you need to be able to provide emergency care at these rural facilities, and that anything else can be referred out? Is that kind of the route they've gone?
Well, I'm a big believer in that care needs to be provided locally. So certainly emergency services are a huge part of that, because if one of us is out in the woods shooting at something and we injure ourselves, or fall out of a stand, we need somebody there that can provide that service that we need as soon to the accident as possible. And so we need that. But, I'll also say it's important for our larger hospitals to be able to discharge patients back home. And so, if that rural hospital is able to care for a patient that has been treated at a higher level facility, maybe in Jackson, and then that patient's able to go home and convalesce in a hospital, they're not able to go home, but they're able to go back to a local community where their family members live, their caregivers are, their church members are, they can go visit them. That speeds the recovery. So maybe they're in a swing bed, maybe they're in a rehab type of a bed where they're going through therapy to try to get better. And but they need that inpatient level of care. If that rural hospital is there, then that patient doesn't have to drive, and their family members don't have to drive a long distance to get that care. So, and if you're receiving cancer treatments and whatnot, you don't feel good. You don't want to have to drive an hour and a half just to come 2, 3, 4 times a week for some treatments. So it makes a difference.
Last thing for you, and we're running low on time here. Staffing shortages have been a huge issue, especially in the nursing community. We saw that during the the COVID pandemic at, kind of its height, and that being such a huge deal, travel nurses making tons and tons of money and coming in, and hospitals trying to kind of figure out how to pay for those. In terms of staffing, progress being made?
Some. We reinstituted a program a couple of years ago that helps with the pipeline of nurses. We've got schools coming online, such as Mississippi State over Meridian. They're doing some really cool things with some accelerated programs that are taking, what I would say are some of the non-traditional tracks and putting them through an accelerated nursing course. Went over to visit with them and super impressed with what they're doing over at Meridian. So, yes, so we're building a pipeline. It's stabilized somewhat, but we've still got some work to do.
Richard, really appreciate your time this morning. Thanks for bringing us up to date on some of the issues. I'm sure we will be talking again as we get closer to or into this legislative calendar. Thanks so much, and happy Thanksgiving to you and your family.
Happy Thanksgiving to you too, Richard. Enjoyed meeting with you, and please tell Paul hello.
We'll do it. Richard Roberson, President and CEO of the Mississippi Hospital Association. We will take a timeout. We'll come back with you and wrap up the 7 o'clock hour. This is the Gallo Radio Show on SuperTalk Mississippi.